my own testimonial about what happened with my heart. People have asked me about that. So I knew I had PVCs when I was in high school. I used to be a runner, a long distance runner. And when I was at rest, I would get these preventricular contractions that would skip a beat. And it was just random, it just kind of bothersome, especially when you're trying to sleep or something like that. And your heart just every once in a while skips a beat. Preventricular contractions. I had and stuck again. I don't know what's going on advance. There we go. I started using GHK copper peptide in April of 2020. In about 4.5 months later, the PVCs changed and they became really rhythmic. And it was every fifth beat, day and night, every fifth beat. If you're losing about a second of circulation every 5 seconds, it's like you go into oxygen deprivation, and I would wake up at night gasping for air. So I thought I had this knee replacement coming up in August, and I was getting kind of worried. I'm thinking something bad's going on with my heart. So I made an appointment with a cardiologist. I had my first stress echo that showed that I had a right bundle branch block. I didn't even know I had it. I've been using the GHK copper peptide for about 4.5 months. Didn't know that I had that right bundle branch block. And the cardiologist came in after the test and said, your heart responded really well to exercise. And I wanted to say, yeah, I already knew that. But he said, you just have these PVCs and a right bundle branch block. And I said, well, what causes that? And he said, well, we get the apoptotic cells, our body kills off cells because they're old, and the same thing happens in the heart, but you just can't replace them fast enough. And the light went on for me, and I thought, I have no proof of this, by the way, but this makes sense to me. The GHK copper peptide elevates your stem cells. So I'm thinking maybe I have a lot more stem cells in my body, and they just don't know how to do their job yet. They're all misfiring at the same time. This is my thought. It may have been totally untrue. But a couple of weeks later, if I can get this to advance, there we go. A couple of weeks later, the PVCs were gone. And then here's the test. It says, the baseline ECG shows sinus rhythm with a right bundle branch block. And then we go down here, compatible with right bundle branch block. You can't read that. I just read it for you. If you have a right bundle branch block, it's associated with an increased risk of all-cause mortality and indicates a poor prognosis in patients who have an acute myocardial infarction. So that's what I was faced with unknowingly. I didn't know that I had that, and then all of a sudden, I'd have that test, and then it shows up. A year and a half later, I had, see if I can get it to advance for me. There we go. Oh, this shows. It has to do with the conductivity of the right ventricle that pumps blood out to your lungs to get oxygen, and then it comes back to the heart. Here's my second one, and I'm going to zoom in right here. This is the results. Right bundle branch block is no longer present. Now, can I say 100% it was because of the GHK copper peptide? No, but 2 cardiologists have said they've never seen one go away. So I'm going to say it's more likely than not, and I sound like an attorney, it's more likely than not that helped me, and it changed my life. And when I got this on the app called MyChart from my cardiologist's office, Dr. Reiter, your study was normal with no issues noted. So nothing. So here I am, 69 years old, and I'm not faced with what most people are faced with when they have those types of things going on in the heart. So that, I hope you have a deeper understanding of what the GHK copper peptide can do